I'm Jayapriya.
Hi, I'm Subiksha.
Welcome to Faculty of Occupational Therapy Department.
Hi, I'm Rita. This is our BOT department. This is where we learn, grow, adapt and build.
Hi, I'm Yogeshwari. Let's go to see our classes. What is occupational therapy? This question arises quite often and we start thinking and correlating occupation with therapy. To know more information, let's continue with Aisha.
Who are OTs? So the term occupation doesn't just refer to jobs. It means any activity that occupies time and gives life a purpose. So an occupational therapist helps people with physical, mental, or cognitive challenges to develop, recover, or to maintain the skills needed for their daily living and work. So the main aim of OT is to help people achieve their goals and live life independently. So we can compare OTs to a sports coach. Just like how they help athletes to improve their game, we help people, that is OTs help people to improve their ability to live life to the fullest.
What is occupational therapy? Practice of occupational therapy means therapeutic use of everyday life occupations with persons, groups, or population to support occupational performance and participation.
So, do you treat disabled people?
We don't treat disabled people, we treat different people, and now I'll tell you the difference about it.
Disabled typically refers to a person that has mental, physical, or sensory impairment that limits the interaction with the world as same as others.
Different, on the other hand, simply acknowledges that something or someone is not the same as other. It doesn't necessarily imply limitation or impairment. Being different can be neutral or even positive aspect of the diversity, highlighting unique qualities, perspectives, and experiences.
Students can choose their area of interest after graduation in occupational therapy. The criteria for UG course is 10 plus 2 pattern with science subjects and 50% above marks.
In the Bachelor of Occupational Therapy course, we learn a mix of theory and practical stuff that gives us a strong foundation and real-life experience. Academically, we cover the subject like anatomy, physiology, psychology, and occupational therapy. Specific topics like assessment and rehabilitation techniques. It's not a boring textbook learning. We actually understand how our body and mind work together and how support the people with different conditions. The practical side is where it gets even more exciting. We get to interact with the real patient during the clinical posting. We try out the different therapy techniques and we work with the kids, elders and adults depending upon the case. It's a course that truly shapes you not just as a student but as a future therapist ready to step into the real world.
After finishing your Bachelor of Occupational Therapy, you can work in hospital, rehab centers, schools, or even open your own practices. Some people choose further studies and masters in occupational therapy. It is a field of more options and lot of room to grow.
Hi, I'm Rehan. I'm going to talk about job opportunities. Open your own OT clinic or wellness center. Provide home-based therapy or teletherapy. Offer workshop for caregivers or teachers.
Hi, I am Siju. I want to speak about job opportunity in clinical. Occupational therapist works in hospitals, rehabilitation center, mental health facilities, and outpatient clinics.
Hi, I'm Sneha. I'm going to talk about job opportunities in academy. After completing your Bachelor of Occupational Therapy, there are great academic opportunities. You can also work in special education school or assist students with different learning needs. Some OTs become fieldwork coordinators like teachers in institutions or rehab centers also available. With the growing demand of occupational therapists, the academic field offers a fulfilling career with lots of impact.
Occupational therapy in neonatology focuses on supporting newborns, those are born early or with medical complication. We help them to improve the important skills like feeding, movement, and bonding with their parents. Therapists work closely in NICUs to create a calm and safe environment that supports them to growth and development. Our motto is to give these tiny patients the best way to start their life.
Hi, I am Mahabadi. Today I am talking about pediatric infant. Occupational therapy for infant help them essential skills for growth and development through play-based intellectual and sensory experiences. Occupational therapy supports infants in achieving milestones such as bonding, feeding, and motor skills by addressing challenges and promoting healthy development. Occupational therapy enable infant to thrive and reach their full potential.
Free audio post-production by alphonic.com.
Hi, I am Sauparnika. I am here to speak a few words about toddlers and occupational therapy. Occupational therapy in toddlers is focused on developing and help their skills to develop in each and every activities. In India, including in Chennai, occupational therapy services for toddlers are available in hospitals, clinics, and in therapy centers. A key component for occupational therapy involves family in the therapy process.
Hi, I am Bhuvanesh. I am going to talk about psychiatry and scope of psychiatry. What is psychiatry? Psychiatry is a branch of medicine that diagnoses and treats mental health disorder. Scope of psychiatry. Occupational therapy in psychiatry is all about helping people with mental health challenges and live more independently, feel better in daily lives. It uses activity and routines to improve skills like self-care, socializing, managing emotions, so individual can feel more confident and in control.
Hi, I'm Srinitra and I'm here to talk about scope of occupational therapy in neurology. First of all, what is neurology? Neurology is the study and treatment of brain, spinal cord, and nerves. Scope of occupational therapy in neurology helps people recover and regain their everyday activities after conditions like stroke and brain injuries and disease like Parkinson's. We focus on basic activities like eating, dressing, and moving around, like along with memory and concentration. We also help with sensory issues like numbness and tickling. So it's all about just us treating them to be more confident and more independent in their lives.
Hi, I'm Rishi. I'm going to talk about orthopedics and OT in orthopedics. What is orthopedics? Orthopedics is a branch of medical that deals with bones, joints, and muscles. How OT works in orthopedics? We help to improve their strength, movements, coordination, and train them accordingly. And we make them functionally independent and gain confidence.
A classroom best suited for studying combines modern technology with comfort and practicality to create an ideal learning environment. Such a classroom is well ventilated, ensuring a constant supply of fresh air that keeps students alert and focused. It would also feature a centralized air conditioning system, maintaining a comfortable temperature throughout the time. At the front of the classroom, a smartboard would serve as the hub of interactive learning, allowing teachers to present lessons dynamically, integrate multimedia content, and engage students through interactive exercises. Seating arrangements would be carefully designed for maximum comfort and support, with ergonomic chairs and spacious desks that reduce strain during long study hours. Proper lighting with both natural and artificial would further help enhance the atmosphere, making the space welcoming and conducive to concentration. Altogether, such a classroom balances technology, comfort throughout the design to support effective and enjoyable learning.